All right, so for abdominoplasty, you gotta expect that you're gonna have a drain. The drain is gonna be there for roughly about a week. We're gonna do lots of lipo. The idea is that there's extra fluid that comes with the lipo. We get that fluid out faster. That's why I use the drain, okay? The other thing that you wanna know when we do an abdominoplasty is it's gonna hurt. It's gonna hurt for roughly about kind of 5 days. I usually tell people once you get over that edge of the 5 days, it's gonna be better and better each day after that. People start getting back to their independence. Hey, I can get around, do my own thing when I get to about a week. By 2 weeks, most people are moving around pretty well. By 3 weeks, most people are kind of getting back to work and things like that. What you have to know is you have to wear a binder for about 6 weeks. So it's going to be some liposuction foam. You're going to wear a binder over the top of that. And you're going to consistently wear that for 6 weeks. Once you get past 6 weeks, then we can kind of ditch the binder for the most part, except for like after exercise and things like that. You want to put the binder back on just to reduce some of the swelling and things like that. We are going to give you multiple medications that will kind of help with a muscle relaxer for the muscles. We'll also give you some pain medication, but you'll quickly be able to kind of ease out of that and not have to worry about taking narcotics for very long. After about a week, most people are kind of off the narcotics. They're taking some Tylenol, taking some Aleve, different things like that. One of the things you got to know is like right when you're done with the abdominoplasty, it's going to be really tight. I'm going to pull everything really tight for the skin. So you're going to have to kind of position yourself. I call them the beach chair position. So your knees are bent, you got pillows under your legs, you got pillows behind your back, just to be able to kind of support everything. And you need to kind of sleep in that position because you don't want to sleep on your stomach till you get to closer to 6 weeks. You don't really want to be sleeping on one side or the other, otherwise your swelling can be more prominent on one side versus the other. So these are just a couple of the key things you need to know kind of going into abdominoplasty. When it comes to the incisions, we try to make them so they're waterproof. So you're going to have some waterproof dressings over the top along with some waterproof glue. It becomes a simple process of just kind of removing those bandages after a couple days. You can shower, wash. Most patients feel like, hey, I took a shower. I feel excellent after a shower, especially after surgery. And that's probably the biggest relief that you kind of get after surgery is that, hey, you're in a lot of pain, but you can kind of shower, you can rinse off, you can kind of reset after things. And when it comes to scars after, typically when you get past 2-3 weeks, we will kind of do some scar tape and things like that. So you don't have to worry about buying extra stuff or anything like that for your scars. We'll kind of offer that to you. And we'll kind of go through that as you kind of get into your post-op period for there.